Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the iClearScope endoscope. And here we have a patient who attended with a fully blocked left ear. And upon first inspection, I felt this wax plug may be firm enough for me to extract using the right angled ear hook. However, although I managed to insert it over the top of the plug against the roof of the canal wall and then embed the tapered tip into the plug, as I began to extract it, the core of this plug was really soft and mushy. And as you can see, it's just dissected right through it like a hot knife through butter. So I've gone back to microsuction, and what I'm doing here is just elevating some of this more crustier wax near the entrance away from the posterior canal wall. They have got a bit of a narrow entrance, and also their cartilage is quite thick and rigid. Typically cartilage in the outer third of the ear is quite malleable. Now there was some flexibility there, but I had to apply a bit more force with the endoscope to dilate the ear canal, which wasn't a problem. We managed to do that. So this plug extends all the way to the eardrum, and for the latter part of the procedure we're essentially just removing wax off the eardrum. Unfortunately, it was extremely mushy and impacted against the eardrum, so it's quite a challenge. And because they've got quite a twisty, bendy ear canal, it was also quite difficult getting access, particularly into the anterior recess. So that's the front part of the ear canal near the eardrum. There's a widening there. So we had to use the fine end suction tip, and I had to bend it at the tip so I can navigate around the anterior canal wall and gain access into the anterior recess. So whilst you're watching this, I'll just give you an update on what's been going on for the last few days and even weeks. I apologise I haven't uploaded recently. It's just been so much going on. And some of you may have seen my clip on the piece, the news story about earwax removal on the BBC, both on the breakfast show, which is all it was originally planned for, but because it gained so much traction, they actually then aired it later on the main BBC News lunchtime. So if you live in the UK, you'll be aware of the BBC and the breakfast show and their news segments. They normally have a breakfast show every morning, I think between 6 and 9 o'clock. So it got featured twice on the breakfast show. Then BBC News, national news, they have a slot at 1 o'clock, I believe, and then one at 6 p.m. and one at 10 p.m. And I was told by the BBC producer, the journalist that attended, that it may also be featured in the evening and late night news, but some more news stories broke, so obviously it got pushed off the agenda. But I'll explain what I have uploaded the video clip on both the Wax Whisperer YouTube channel and the Clearwax YouTube channel. And if you're watching across other platforms, I have uploaded it on TikTok, Instagram, Facebook, for example. But I got contacted by the BBC, I think last week, and they informed me they're doing a feature on earwax removal, and mainly mainly the lack of NHS provision. So many years ago, up until 5 years ago, I would say really, patients were able to visit their GP in the UK and have their ears irrigated. So irrigation is separate and different from syringing. Syringing, in the UK at least, we categorise that as the old metal syringe, high pressure syringe, where it's manually pumped water into the ear via this metal syringe. And it's quite a dangerous technique, so a lot of patients experience perforation of the eardrum because of the high pressure. Also, there were decontamination issues, so a lot of patients also developed otitis externa, or what we actually call iatrogenic otitis externa, so it's caused by the procedure itself. So in the UK, ear syringing is no longer available. Instead, it's an electronic pump, so we call that an ear irrigator, actually derived from an oral care irrigator, so what dentists and dental hygienists would use when you visit them at the dental surgery to have your teeth examined and cleaned, for example. I think it was a dental nurse actually said, well, this could be used for ear irrigation. And the benefits of an electronic ear irrigator is that the flow rate can be controlled, and there's less decontamination issues as well. But there is, if you watch my videos, I've talked about the risk of getting water in your ear, and that includes ear irrigation. But it is on the NICE guidelines, which is the National Institute of Clinical Evidence, I think it is. So it's what healthcare professionals, medical professionals, kind of not abide by, but it's their recommendations in terms of different treatments and diagnoses, etc. So yeah, that's no longer really available in the UK to the members of the public. It's a postcode lottery. It depends where you are, but I would say the majority of the country you can't get this access, which has meant there's a big demand in the private sector to offer this service, but also patients are taking matters into their own hands and attempting DIY methods. And so the first bit of the BBC piece was showing some of the DIY disasters where some of the videos I've uploaded on my YouTube channel over the years. So foreign objects that got lodged in the ear whilst the patient was attempting to use it to remove the wax. Then it went on to a patient who I can disclose. I can't say the name, but I can disclose they went to High Street Hearing Company, who are notorious for training members of the public and their own clinical staff to perform earwax removal. And the lady in the feature has had earwax removal before, but after this visit, they were so distraught that they lived with earwax in their ears for 3 years because they're too frightened to have it removed again. Such was the experience. She even said that she can tolerate pain, and she's had 4 children, but this was on another level. It was horrendous pain. And the lady's daughter was also featured, just explaining how much it's impacted her mother, not being able to hear. It's become isolating and depressing for her. And eventually the GP referred the patient to the hospital, to the ENT department, where either they had the wax removed by an ENT nurse or an ENT doctor, and that restored faith for the patient, because they know that, well, if it happens again, they can hopefully get another referral. So the piece I went back to myself, and I just talked about, a lot of it was edited out. It was a 5-minute clip, but I think my feature's less than 2 minutes. But so I think the message got across, but there was a lot more meat around the bone, if you like. But a lot of it did have to get it out, and I appreciate that. They did explain that. But it was just also the second problem arising from the lack of NHS provision is that there's a big demand in the private sector, and where there's demand, there's cowboys. And unfortunately, and I've mentioned this before, it's our own audiology profession that's responsible for this. So not only are there training companies within the audiology sector training lay people, some members of the public who've got no experience with ears, but also lay people, healthcare professionals. So what I mean by that is healthcare professionals that've got no training experience whatsoever with ears. And to name but a few, common ones are podiatrist, occupational therapist, a dental hygienist. We've had opticians, physiotherapists, contactors in the past. And then there's people like, beauticians, accountants, for example, a tattoo artist. These people already got trained elsewhere, and they've contacted us over the years because they want to get trained by myself, which obviously I flatly refuse. But also, not only is it training companies, it's hearing companies, and it's so depressing and hard for me to kind of acknowledge this because it's the profession I'm in. But there's hearing companies, both small independent companies like myself, I'm not a national company, my own company, so small local companies, but also not all, I have to stress that, but at least a couple of national hearing companies. And in fact, only today, after all this press that we've managed to obtain, and you can't really get bigger than the BBC News in the UK. When I posted some stuff up on my LinkedIn, there was someone, I didn't realise they were a contact, but they looked at my profile so I could see who it was. And because of the company they work for, I looked at their job description, and only yesterday this person was a branch coordinator, which basically means Your front of house, you might be heading that, or you might be working as an assistant there, but it's like my clinic manager I have at my clinic, Tracy. And then today I looked on LinkedIn, and this person had updated their job status to say that they're now an ear care practitioner. So from coming from a non-clinical position as a branch coordinator within this national hearing company, they've obviously got trained, inverted commas, to become an ear care practitioner. So some of the names, guys, you have to be wary of is ear care practitioner. That's a big one. Audiology practitioner. So these names are what a lot of the high street call their inverted commas earwax removal specialist. Unfortunately, some of them don't use these names. They may even call themselves audiologists because it's not a protected title, or at least on their website they might make reference to these individuals as hearing experts, which they are clearly not. But one of the good things that happened since yesterday, I've been inundated by messages by my peers and colleagues who've all said that since, well, most of the bookings they've taken since the BBC piece is where when patients are booking, they are questioning the credentials. Now, guys, my colleagues are fully trained, but they don't mind. They don't find it insult. In fact, they want you to, so it's okay because they want you to do your due diligence. Your ears are precious, and as you know, if you're entering the profession that we're in, we're concerned about your ears. So keep continuing to do that. And the questions you need to ask, if ever you come across these bogus names like ear care practitioner, wax removal technician, audiology practitioner, ask them what is their healthcare title, what healthcare medical job did they train for. For example, a nurse, a GP or GP physician associate, an audiologist, a hearing aid dispenser, an ENT specialist, for example. Ask what their profession is. An ear care practitioner is not. It's a made up title. So you can't train to become an ear care practitioner, like in the sense of a degree course, and then you're not a member of a professional regulating body. Now, what some of these people then say is that they're part of a professional body. Now, if they are part of a professional body, it's and I'm going to name them because I've mentioned them before. BSHAR, the British Society of Hearing Aid Audiologists. If you remember, a couple of years ago, I had a campaign against BSHAR because they were trying to allow these lay people who are doing wax removal to become associate members of BSHAR, giving them some legitimacy. And after all the campaigning and support I've had from you guys, they withdrew, well, they at least said they're going to pause that proposal. And then earlier this year, I discovered, just by looking at their website, they were actually, there was a section on their membership page where if you were an earwax removal practitioner, you could become an associate member. And when I brought it to BSHAR's attention publicly, within the next day, they took that off. So if they say, because what a lot of these ear care, that's the whole aim of BSHAR. They were trying to allow these ear care practitioners to become associate members to give them some legitimacy, inverted commas again. So if they say to you, these ear care practitioners or audiology practitioners, etc., that, oh, we're part of BSHAR, it doesn't mean anything, guys. I'm telling you, it doesn't mean anything. And they may also tell you that they're insured. Now, they may well be insured, but the problem is insurance companies will insure anyone. And I've spoken to these insurance companies. And essentially it says, look, we'll train anyone. But the problem then is if something happens and this lay person is taken to court, they will then need to prove, they need to read all the fine print when they take the insurance policies out. It's not like car insurance where they vet you, essentially. With these insurance companies, they will give it to you. The problem is if something happens and they call an expert witness like myself, I will obviously not support that individual, and I will say there shouldn't be anywhere near anyone's ears. And as a manufacturer of earwax removal visualization devices and removal instruments, we tell, so part of our technical file, which is what we have to submit for the regulatory part, is that lay people shouldn't be using this. So straight away their credentials are going to be questioned, and that may also invalidate the insurance. So again, the point I'm trying to make is don't be fooled if they said they've got insurance. It doesn't mean anything as such, in the sense where it doesn't give them their title any legitimacy. Obviously, if something does happen, hopefully you'll get you get compensated if their policy doesn't become invalid after their credentials are questioned. But yeah, sorry, I didn't really, obviously I kind of explained at the beginning, but I hope you enjoyed that video, guys. Take care, keep well, speak soon.